Hi, Kevin Henry, the Group Editorial Director for Advanced Star and Dental Products Report. I'm here today with Dr. Harvey Silverman. How you doing today?
Kevin, doing great. I'm looking forward to talking to you today about how dentists and their team members can expand the cosmetic dentistry practice.
Absolutely. You know, in the first part of this technique video series, we actually showed the technique for the EasySmile Lifelike veneers. Dr. Silverman actually did one on me. It took about, a minute 35, I think it was?
Yeah, a minute 35 seconds to create a veneer from scratch.
It was very cool.
And it wasn't a preformed veneer.
No, not at all.
No, it was from scratch, and so I'm sorry.
So, no, you're fine. Just make sure you check out that video. And so what we're going to do in the second part of this is Dr. Silver and I are going to talk about the role of the team working with this, promoting this, and helping the practice grow. I'm a firm believer that any dental practice that is looking to grow has to have a team that is completely on board and completely behind the vision of the practice and the dentist. So let's talk about, from your vantage point, with this program, where does the team play an integral role?
Wow, the team is it's the locomotive that drives the train. Without a properly trained team member, especially with our EasySmile veneer system, it will never take off. A lot of dentists have products that sit on the shelf. They go to a seminar on a weekend, and he or she comes back to the office saying, I got this great new system and new technology, and we're gonna put this into place. And sure enough, a week, everyone's nodding their head, and the team members are thinking, we've heard this before, and it's not gonna happen. Right. So the best laid plans, as they say. In our program, we've been doing this for 20 years now in dental offices, and we found that if I teach a dentist and I provide them with a complimentary hands-on training webinar on how to perform the technical skill, how to create an EasySmile veneer in under 2 minutes, which again sounds at first blush too good to be true, but it actually, as you experience, it happens.
Yep.
And they're not preformed veneers. These are actual veneers that we make from scratch that are custom made to your particular problem, your needs. Right. So if I teach you that, it's not going to be very effective in terms of getting your patients informed, educated, and motivated to do something to transform their own smile. And earlier in the other interview, we talked about the 80%, 8 out of 10 patients have at least one tooth they want to change the size, the shape, or the appearance of. Right. We need to gather and find out what that tooth is or teeth are in terms of what the patient wants to change as compared to what, I had one dentist who wrote me a testimonial letter after I went to her office, and she said, thank you so much for helping me, see. Because so often you're treating patients and you see you're not seeing the forest, you're seeing the trees.
Right.
And in this case, we need to be able to find out what our patients want. So we definitely are team-centered. Exactly. The whole approach is team-centered.
Yeah, because one of the things that I always talk about is how that the assistant is in the room with the patient, and you may leave the room, and then the patient will turn to the assistant and say, "What do you think?" And so this is one of those times that it looks like something that really, as long as the team is on board, the team understands the process, everything else, it's a nice marketing point.
Well, thank you, Kevin. And what's really important is we like to get the ball rolling from the receptionist on, because when a patient comes in, we use the principle called the 80% rule. 80% of the time when the dentist is in the back treating one patient, someone or something is going on in the rest of the office to inform, again, educate, and motivate the patients about transformations that can occur in their smile that are non-invasive that can benefit them. And when a receptionist gets a health history form filled out, and we call ours a smile enhancement form, which we provide to all the dentists that we train. We do not send out these forms unless someone has been trained in our complimentary hands-on training webinar. But once you gain that information, then you want the receptionist to highlight if the patient has, stained teeth or spaces between teeth or uneven teeth or whatever it happens to be. But rather than just highlighting it, then we train the team from the receptionist on. In the case of the receptionist would then provide the patient with an opportunity to see how Dr. Wonderful made this great transformation and how they were amazed by this transformation. Now, this is very important. We never, ever, ever sell cosmetic dentistry. It may sound strange because you might think that I'd be promoting how to market and thus sell. I believe in the no selling approach. I believe it's very important to let people know how they can benefit, but you don't have to sell someone to do that. All you need to do is inform, educate, and motivate. That's no different than what we do when we do our perio instructions and we're trying to teach people plaque control and so forth. And it's the same thing what we do when the receptionist is talking sincerely and is talking about how they saw this transformation occur in your practice. And you want that receptionist to come back to the treatment room and once a month watch you do a smile preview, maybe more often if you want to. It only takes 2 minutes to do this. Right. But then they can sincerely talk about how they were amazed by how you can do this transformation. So it starts with the receptionist, and it continues with the receptionist giving feedback and information then to the next person in the team who works with the patient. That could be the hygienist, it could be the dental assistant, depending on how it's being routed on that particular appointment. But the key is once the patient has been informed and educated with, for instance, a photo album in the reception room by the receptionist where they show these comparable before and after pictures that patient has, then the assistant or the hygienist will now know that Mrs. Smith, the patient, has this particular concern. And she could then talk about the same issue as well, reinforcing what the receptionist said. So by the time and it's obviously far more detailed than this, which we provide in our in our webinar programs, as well as we do on-site training and regional symposiums and seminars. But the key is you want the entire team on the same page. So by the time the patient sees the dentist, the patient will be saying, I hope I'm a candidate for this, because they're so excited about the transformations that they've seen and the sincerity of the team members who've informed, educated, and motivated the patient to see whether or not they can benefit. And when it comes to the EasySmile system, the benefit is now you can do just one tooth, maybe with some tooth whitening, but very often one tooth with some tooth whitening, it's very affordable, so that's no longer an issue to the patient. And it allows more patients to say yes to treatment. Because if it's too expensive and you're going to be talking in today's economy about doing 6, 8, 10 veneers and multiple appointments, patients are going to say again, let me think about it. And with the EasySmile system, with this whole approach, patients instead say, once we do the smile preview veneer on the teeth, they say, oh, can you just keep that in there? I want to, can you just cement it in permanently? It's a huge mindset transformation for patients because they've experienced it's totally painless in the truest sense of the word, because it's totally non-invasive, and they've been able to see how it blends in with their adjacent teeth. And if they don't like the color or the size or the shape, you can make that transformation before you decide to take on the case. I don't know of any other procedure in dentistry that allows you to achieve the final results before you actually begin, and it's all because the team is involved from the start of the program.
And again, make sure that you watch the first part of our series we're doing here, where you can actually see the veneer on me. And Dr. Silverman, I'll let you go ahead and just let the viewer know where they can get more information on your program.
Well, thank you, Kevin. The best way is to go to our website, which is www.silvermaninstitute.com. That's spelled SILVERMANINSTITUTE.com. And when you go to the website, you'll be able to browse a ton of before and after pictures with the EasySmile system. You'll read lots of testimonials from other dentists just like you and me who literally have seen their cosmetic dentistry practice taken to the next level with these team-centered campaigns and approaches. It's so easy to do. It's professional, it's ethical, and there's absolutely no selling ever involved. So give it a look. I think you'll definitely find it to be time well spent.
Always a pleasure, my friend. Thanks for your time.
Thank you, Kevin.